Hello. Good afternoon, Mr. Hope.
Good afternoon, doctor.
Yeah, my name is Dr. Nida, and I am here as a neonatal specialist registrar.
Okay, doctor.
So, Mr. Hope, I want to congratulate you because you got such a adorable baby, Lily.
Yes, doctor. Yes, we are waiting for Lily for maybe around
Hmm.
5 years.
Oh, that's very, beyond the imagination when you got your child in your hand. So
Yes, doctor.
it's a speechless. Yes. How's your wife? Is she okay?
Yes, doctor. I
Mm.
just met her and she is fine.
Okay, that's good. And how was your experience as a father?
Doctor, I am feeling very happy, I must say.
Yes, yes, yes. So, Mr. Hope, what's the update about the Lily's condition?
Doctor, doctor, I know that there is some problem with her
Mm.
food pipe, and
Mm-hmm.
me and my wife, we both are aware of that
Mm-hmm.
when 20-week scan was done.
Yeah.
But but now I'm a bit concerned about that, and I was actually waiting for you.
Yes, yes. Actually, today we are here to discuss about the Lily's health condition. So, you want anybody else to join our discussion, or it's okay with you?
No, doctor, right now I am all alone, so you can discuss with me.
Okay, Mr. Hope, let's imagine with me, as you are already aware of this condition, that in normal condition that we have one pipe that is in front, that is wind, that is the air pipe, and just behind that there is a pipe for the food also, that is for the food. In you and are in normal condition there is no connection, as you already aware that, but in Lily's condition, that there is some connection. So because of that the Lily has that. So uh, I know that am I understandable up till now?
Yes, doctor, I am trying to understand, and you are quite clear till now.
Mhm. That's good. That's good. So, Mr. Hope, let's talk a bit ahead towards the Lily's health condition because we have to, manage. We have to treat her as soon as possible condition.
Mhm.
And
So,
for
doctor,
that,
uh, can we feed her now?
I am expecting this question, you as a father, but right now we will feed not by the mouth, but of course, we will feed her by some blood tubes and blood channels. Am I clear up till now, Mr. Hope?
Yes, doctor. Yes.
Yes. So, and for this reasons, we will do some test.
Okay.
Yeah.
Like what, doctor?
Yeah, there is other problems also that can be associated with this. So we will do some X-ray of the bone. We will do some jelly scan of the heart, and we will do some blood tests also. Are you with me,
Okay,
Mr. Hope?
doctor. Yes, doctor.
So and there are group of other doctor, team of other doctor will also involve that will help you.
Okay, doctor. So you mean to say that Lily will be staying here in the baby unit?
Yes, of course. And there also doctors of other specialty will also come and they do some tests and they will visit her.
Okay, doctor. So, doctor, what are your plans for her now?
Yeah. Mr. Hope, actually, we are planning first for all, our pediatric surgeon will come and assist her, and we will not give anything from her mouth because it will be very dangerous for her, and we will provide the food by the some blood channels, and we will run some tests, and we will call the specialty of other doctors also. Am I
Okay, doctor.
understandable up till?
Yes, doctor. Doctor, I was told in last meeting that you all will be doing some surgery also for that.
Yes, yes, yes. Of course, we will do some surgery and we will inform you each and every detail about that procedure also.
But doctor, I'm very much scared of surgery. I'm not. Uh, uh, we have actually, me and my wife, we have never thought that our baby will be undergoing surgery on day 1 or 2 of life. So, is there any other way out?
I feel so sorry because you are thinking like that, but surgery is the ultimate or is the final option for that baby. Meanwhile, we will arrange a meeting with the pediatric surgeon also, so he will guide you accordingly.
Okay, doctor. So, doctor, I would like to know that for how long Lily has to stay here in the baby unit? 3 minutes left.
Okay, Mr. Hope, we will tell you. I cannot give you a certain time that how much she will stay, but we will arrange a meeting with the pediatric surgeon, and maybe with the after surgery she will stay in this intensive care unit, maybe for a week.
Okay, doctor. Okay. Mhm. So, doctor, how
So,
is the outlook for babies with this type of problem?
Mr. Hope, fortunately, the outcome is very good, and 50 to 60% of the kids they usually attend the normal activities and they grow up like the other kids.
Okay, doctor. Okay.
Am I clear up till now?
Yes, doctor. I am feeling a bit relieved after talking to you, I must say.
That's pleasure. So today we discuss about the condition that Mr. Hope you have already informed at the age of at when the child was around 20th week, and she has some polyhydramnios, some excessive fluid, and there was a absent of there was some anomaly. The jelly scan has been done, and after that, the Lily was diagnosed with the condition known as tracheoesophageal fistula. As far as condition is concerned, I have been informed you regarding the management regarding the investigation and what will be the team of the doctors, what are the teams of the doctors will involve in that whole condition. So I think today we discuss about a lot about this tracheoesophageal fistula condition, and we discuss all most of the things. So, Mr. Hope, I have a very informative website. So you just log in and then have a look. There's some pictures also that will make you more clarify. And second thing that there's a leaflet in my hand. You just have a look and you can show to your wife also. So you both parents will aware about that condition.
Okay,
And
doctor.
one last but not least, there is also a support group where the parents having the same problems and they have the same experiences. So they share on the support group, and it's really helpful.
Okay, doctor.
So just join the support group, and it will help you. I think so.
Thank you, doctor, very much for your time.
Thank you, Mr. Hope. Bye.
11 seconds remaining.
Acha.
Okay. So, Dr. Bila will be giving you feedback first.
Yes, it was very nice, Dr. Nida. You were fluent, confident. The voice was very clear, and you were taking pauses in between, checking the understanding. So I think it was very good. I cannot pick any mistakes or anything to improve. I think everything was very clear, and information, the way of explaining,
No, no, no,
that's
no.
all from my
Dr.
side.
Billa, there is always a chance of correction. So, uh,
Yes, you are right. So Dr. Manish will point out.
mhm. Dr. Manish, go ahead, please.
So, you introduced well, and then you established rapport. I was very happy with that. And then you clarify the agenda, you ask for attendance, and then you ask my concern that why I have come here today. And then what I think is that you started explaining to me esophageal atresia. It is basically esophageal atresia because the information which I gave you was that there is absent stomach bubble. Okay, at 20 weeks USG scan, and there is polyhydramnios. So that is going in favor of esophageal atresia. Okay, so esophageal atresia with tracheoesophageal fistula is the term that we commonly use for this type of uh, problem. Okay,
Mhm.
so what I think is that it was difficult for me to understand the way you were explaining.
No, 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 no. I said that there are two pipes. I know in between, yeah, I told Mr. Hope that he has been discussed that problem, but I just want to, summarize because if I say that he will not be unaware of that. So I thought that I'm repeating that because in scenario he has been informed by the staff, but I
So,
said
so
that
the
there is
moment,
one pipe.
so, so the moment I told you, the moment I told
Mhm.
you that yes, we are aware of this problem. So the next thing you should have said that you are absolutely right, Mr. Hope. In fact, we
Mhm.
have examined Lily and we have found that his food pipe is not formed completely.
Hmm.
And then I ask you that, can I feed my baby? Then you have to say that, as I have mentioned, that food pipe has not formed completely. So you won't be able to feed your baby. And even if you try to feed, then it won't be going to the stomach. Am I making myself clear? So you can tell father in one or two or three simple sentences about it.
Okay.
Okay.
Hmm.
So you showed appropriate level of confidence. Okay. And throughout the communication, I noticed that you are very much confident. You were maintaining eye contact with me, and you were replying to me spontaneously. So that is actually needed. And to me, I got impression that you have done this or you are doing this quite frequently. Okay, and this is what they are looking for, and you were actively listening to me, and you displayed interest in listening to my concern. Okay, and you allowed me opportunity to speak also. And instead of saying pediatric surgeon, you should have said that you will be having meeting with baby surgeon.
Okay.
Okay,
Mm-hmm. Okay. Next time I will say baby surgeon.
baby
Okay.
surgeon, or
On
say just
baby
say
surgeon.
surgeon, or say surgeon. Mhm.
Mm-hmm. Okay.
Dr. Manish, the prognosis she explained, can you verify the prognosis?
Yes, see, esophageal atresia with tracheoesophageal fistula may occur as an isolated problem. Okay, or it may be associated with other conditions like heart conditions or some other conditions. So if it is occurring as an isolated condition, then the prognosis is good. Okay. But if it is associated with some other problem, then prognosis depend upon other problem also. Suppose it is associated with some cardiac condition. So that also you have to take into consideration. Okay.
Dr.
Dr.
Manish, good
Manish, it
afternoon.
will not
Uh,
depend.
Yes,
Sorry.
yes.
Actually, she asked that we want to go to some blood test as well as the bone test and jelly skin of the heart. So, is there any need here to say?
Whenever there is one anomaly, the dictum is that you look for other anomalies.
Yeah, but she should then she should mention that why we are going to do these other tests.
Big. Yes, actually, at that moment, Dr. Neda, you should have told me that right now, what we will be doing is that we will be admitting Lily in baby unit. We won't be giving anything to her by mouth. We will be starting her on drip of fluids. Okay, and then you will be meeting a baby surgeon. So you have to tell clear cut that what all your plans are for Lily. Okay. Though you have mentioned, but try to organize that in a better way. What I mean to say. Okay. And then you concluded, well, me, I was expecting you to tell that support groups, and you told me. So there is one charity in UK, Esophageal Fistula Support Group. Okay.
Dr. Manish, they have support group for everything. Even for the acne
Yes.
also they have a support group.
Yes. Yes. So here actually, after surgery also, na, there may be some problem. There may be problem with feeding. There may be problem with growth. Okay, so you have to mention that. Yes, Dr. Vaishali.
My question is that in this scenario, can we say like that we will admit the child, and the priority is the operation, okay, and simultaneously then later we will run some tests to rule out some associated abnormalities. Can we say like that also?
Don't mention about that. See, yes, right now we will be admitting the baby, but we will be let pediatrics surgeon explain that to the parents, na, rather than you explaining that to father. Okay, that is not your job because surgery will be carried out by pediatric surgeon, and then our job is to take care of baby once the surgery is done, and after the baby is stable, we will be again sending back that baby to pediatric surgeon, and they
So
are
at
usually
this
taking care of these babies.
So my question was, sir, that is it necessary to tell the parents at that time about the
Not
associated abnormalities? That
don't
because she will
mention.
get scared, no? Yeah,
Yes,
and
don't
her
mention.
anxiety will, yeah, that she's my child has got so many abnormalities. May
If
he
if
may
if
not
she
survive,
if
something
she
like that.
is if she is specifically asking something, then mention
Uh-huh.
that. If she is not
Okay.
asking you, then don't mention.
Okay. All right. So now here it should be like we have to give a preference to the operation
Yes.
uh, rather
Right
than
now,
the
see,
yes.
right now, what is our preference? Right now, we have to admit the baby. Okay. We won't be feeding this baby. Okay. And if we are not feeding this baby, then we need to start with IV fluids. We have to do some test. Okay. Because
Mhm.
before going for surgery, we need to do some tests now. We need to take some blood samples for full blood count, for blood
Mhm.
grouping, cross matching, isn't it? And then
Mhm.
after that, we will be we ourselves at our end, we will be contacting pediatric surgeon for further workup of the child. Okay, and then after that, we will be shifting that child to pediatric surgeon, and then they will be taking care of that. They will again be explaining to parents about that. They will be taking consent for surgery. It's not our job. Okay,
Mhm.
but we will be telling father about what all overall we will be doing in this
Mhm.
condition. Okay then.